My name is Mackenzie Clavon, and this is my case report about popliteal aneurysms. An aneurysm is an excessive localized enlargement of an artery caused by a weakening of the artery wall. Popliteal aneurysms, although rare, are the second most common aneurysm after abdominal aortic aneurysms. Aneurysms vary in anatomy and therefore are treated differently depending on the category they fall into. They can be dangerous if not diagnosed and treated quickly. This case discusses the importance of the incidental findings and differential diagnosis, as the original study to be done was not related to the aneurysm. Many disease processes have similar symptoms, which is why it is important to look at all the possibilities in order to treat a patient. A 56-year-old male came to the hospital with the bilateral lower extremity swelling and pain, along with right foot numbness and cyanosis. The patient had no history of these symptoms, nor had he had any previous studies. He was on medication for hypertension. The patient was sent to the vascular lab to have a bilateral lower extremity venous study to rule out DVT. The patient was negative for DVT, however, an incidental finding was noted of the right popliteal artery that appeared aneurysmal as well as occluded. Here's an image from the original DVT study measuring the artery at 2.5 by 2.9 centimeters. The ordering physician was contacted and an arterial study was added to the order. An ultrasound was then performed to assess the blood flow through the patient's arteries. The common femoral artery appeared triphasic with normal flow. Each segment distal to the common femoral artery up to the popliteal segment appeared increasingly abnormal. The popliteal artery was in fact proven to be occluded as well as aneurysmal. The arterial segments distal to the popliteal were severely damped and the right digits were absent. Here are the flow sheets from the Parks machine showing the dampened and absent digits. Although rare, popliteal aneurysms can be very dangerous. The cause of aneurysms is not really known, but may include infection, atherosclerosis, poor arterial nutrition, congenital defects, or trauma. The significance of this case is to show the importance of incidental findings and differential diagnosis. Sonographic findings played an important role in the diagnosis and treatment of this patient's leg. With a proximal and distal segment ligation and the implementation of a bypass graft, the patient was able to keep his leg. Here are a couple more images from the arterial study showing absence of flow and measurements of the aneurysm compared to the native segment. And here are some images of some different options for bypass grafts. This was my presentation for popliteal aneurysms. Thank you.